My number 6 in this list is another fantastic medicine, which is Boerhavia diffusa. Now, Boerhavia diffusa, another Indian remedy, which has been used in Ayurvedic literature for time immemorial, and it has another excellent use for cases of raised urea levels, raised creatinine levels, kidney function is compromised, where again you have two common manifestations. One is edema, so there is renal dropsy, water retention, and the other is scanty urine. So many times if you do not get a clear indication for any constitutional remedy, or you are not getting peculiars, remember for Boerhavia the generals are, the common symptoms are its characteristics. So Boerhavia's entire totality is based on water retention, on scanty urine, and when you do not have a clear peculiar symptom or a characteristic symptom, these common symptoms becomes characteristics for Boerhavia diffusa. Again in tincture, 10 drops twice a day, or 6C, 2 globules twice a day at least for 4 to 6 weeks, and these remedies are available and I've used it and I want you to try it as well. So that's a very important Boerhavia diffusa. Number 7 in this list is another very practically used medicine. I'm sure many of you know about this, is Apocynum cannabinum. Apocynum cannabinum. Now with Apocynum, it's a medium-sized remedy, and some of its features are very important to understand. Obviously dropsy is there, water retention is an important part for Apocynum, but along with it few other factors we have to understand. Now Apocynum is one of your few medicines where there is profuse thirst in spite of dropsy. So although there is water retention, but there is profuse thirst. Borike mentions that dropsy is characterized by great thirst and gastric irritability. So great thirst is present with the dropsy. There are two medicines which have this. Remember, Apocynum and acetic acid, which have dropsy with thirst. Arsenic can also have the dropsy with thirst. Whenever they take it, they vomit it out. Dropsy without thirst is apismel. Dropsy with thirst, Apocynum, acetic acid, arsenic. But with arsenic, they vomit the water as soon as taken. So dropsy with thirst is a very important factor for Apocynum. Another very important part of Apocynum is bradycardia. So many times the heart can be affected as well, and the pulse rate is really slow. So bradycardia is present in Apocynum. Again, a word from Borike's Metromedica, diminished frequency of the pulse is a prime indication. So as good as digitalis, as good as Calmia latifolia, which also have bradycardia, as good as Gelsemium, which also have bradycardia, Apocynum has slow pulse or low pulse rate with kidney involvement, with dropsy, with thirst. So that's also an important factor for Apocynum. Another important thing to understand for Apocynum, that the excretions are diminished. So all the excretions are diminished in Apocynum. It could be urine, it could be sweat, all the excretions are diminished. Although they feel thirsty, the water is being collected, there is hardly any outlet, because urine output is diminished, perspiration output is diminished as well in case of Apocynum. Hale says that kidney is the weakest link for Apocynum. So renal dropsy is the characteristic. You can prescribe it in cases of liver dropsy, you can prescribe it in cases of cardiac origin, but renal dropsy is the characteristic of Apocynum. And last but not the least, the emotional or the sensorium factors is important. There is drowsiness, there is a sinking sensation. There is drowsiness, there is a sinking sensation, and it's a bewildered state of mind. As if there is a bewildered state of mind where it's like confusion. They cannot understand or remember or comprehend many things. So cases where there is a sinking, especially in the pit of the stomach around the epigastric area, where there is drowsiness, where there is debility, comes close to Gelsemium. Drowsiness, debility, and a bewildered, confused state where there is poor comprehension, then that can be due to the advancing renal pathology, which compromises even intellectual functioning as well. So that is also quite important to understand for Apocynum cannabinum. So it can be drowsy, it can be debility like Gelsemium, but obviously the thirst is plus. The bewildered, confused state of mind can be there. Now another additional factor which is important to understand is, you can find many times, I'm not a separate place to mention here, but you can find hemorrhage many times in case of Apocynum as well. So hemorrhage can be with kidney diseases, can be hemorrhage in women where there is profuse menstrual bleeding, or it can be hemorrhage at the menopausal period where you can have profuse bleeding as well. And Hale again says that when given in cases of dropsy, Apocynum can restore the periods as well. So patients with amenorrhea and dropsy is there, your Apocynum will help to bring on the periods, also reduce the water retention as well. So hemorrhage can be also an additional factor for Apocynum. If you have the entire totality, go for 30C, 200C in C scale. But if you do not have that entire totality, it's a partial totality, go for tincture or 6C lower potencies as well. So look for the confused state, look for the slow or low pulse, look for dropsy with thirst, and look cases where there is total diminution of all the excretions, even perspiration is not happening. So there is no output of the water intake. Next, number 8 in this list is Juniperus. Juniperus is a remedy which you will find in Boricae, and Juniperus has very interesting use. Again, remember the two combination, cough with scanty urine, right? There is cough and there is scanty urine in Juniperus as well. And one of the very important things to remember for Juniperus is, obviously this can be there in eucalyptus as well, but what is the important part is that there is a weight feeling in the kidney region. So patients will tell you that I feel a heaviness in this area, there's a weight feeling in my renal region, and that is a very classical indication for Juniperus. Clark mentions this as a characteristic, that there's a weight feeling, heavy feeling here. And cough can be an additional factor, scanty urine can be an additional factor, and obviously you can have dropsy as well as an additional factor. So renal dropsy, cough, scanty urine, this can be present with other remedies as well. But the patient, when they say that there is a heaviness in this area, in the renal area, weight feeling here, with this combination, that makes Juniperus a characteristic. So you can think of old persons, you can think of youngsters as well, but that weight feeling with cough, with the scanty urine, with the renal dropsy, that makes Juniperus a characteristic. Tincture 6C, lower potencies for Juniperus, and again it will help you in cases if the patient specifically mentions this. So remember that for Juniperus. Number 9 in this list, we come back to another Kali, and this is Kali nitricum. I shared with you Kali chloricum is wonderful for kidney ailments. So whenever you're thinking of Kali carb next time for kidney patients, remember you have two very specific bullseye medicines, and that is Kali chlor and Kali nitricum. So it's important you hit the simillimum. Kali carb is you're coming close, but if you get clear and better picture of these kidney medicines, go for these, which will be much better adapted. Now Kali nitricum is another diuretic, so you can have dropsy in Kali nitricum as well, so water retention is present. But what is characteristic for Kali nitricum, and you'll find this in Boricae's Metromedica in Clark's dictionary as well, that they can have breathlessness with the dropsy. So with the dropsy there is breathlessness, and the breathlessness is so much that even drinking water is an ordeal. So they're out of breath, they drink only a sip of water, because they cannot drink the entire glass of water because they're out of breath. So in between the breathlessness episodes, they drink a little sip and that quenches their thirst. You'll be compelled to think of arsenic. Yes, arsenic can help, but Kali nitricum doesn't have the anxiety, nor the restlessness, nor the fears of arsenic. So both arsenic and Kali nitricum can drink water in sips, but you have to understand here, for Kali nitricum, it is because of the breathlessness that they need to drink water in sips, and they do not have the opportunity nor the privilege to get that time to drink water, even a glass of water. So I'm sharing this line with you. A peculiar symptom in connection with the asthmatic state, the breathlessness is so great that the patient, though thirsty, can only drink a sip at a time between the breaths, and that's important to understand. They are so much out of breath. And obviously, as it's a Kali, remember all Kalis will have debility. So sweat, backache, weakness is a common feature of the Kelly group, which will also be reflected in Kelly nitricum as well. And another factor which is important for Kelly nitricum, especially emotionally, and Clark mentions this, is ennui. E-N-N-U-I. Ennui is an old terminology for, or Metromedica terminology for indifference. So there is complete indifference, there is complete apathy, they do not like to interact, they do not like to socialize. So there is a state of ennui plus peevishness, where they are quite irritable as well. Peevishness is irritability. So these two are Metromedica words where there is indifference combined with irritability in Kelly nitricum. But even if you don't have that, whenever you get cases of dropsy, the patient has the Kelly triad of sweat, backache and weakness, and with the breathlessness, what is peculiar? They have the thirst in sips, and that is characteristic for Kelly nitricum. And it can work wonderfully in such cases. Emotionally, the patient will be very indifferent, doesn't like to interact, and that you can find with Kelly nitricum as well. Kelly nitricum is a remedy which will prescribe more in 30C and 200C, which works well. Again, like Kelly chlor, if the patient is stable, has improved, not go much higher, but shift to LM potency and keep the patient stable gradually over time with Kelly nitricum. It's another very useful but very underrated medicine which we do not use very often in practice. My number 10 in this list is uranium nitricum. Uranium nitricum is, I'm sure most of you know that it's a celebrated medicine for diabetes mellitus. But to understand uranium nitricum better, I call uranium nitricum as my diabetic lycopodium. Why diabetic lycopodium? Because if you look in Borica's Metromedica for uranium nitricum, you will find it's mentioned that the gas is second only to lycopodium. So there is a lot of distension. So there is a lot of bloating in uranium nitricum, and gas second only to lycopodium. So a lot of bloating, a lot of distension in the abdomen, and that distension is mostly lower abdomen where there is a lot of flatulence. Lower abdomen where there is a lot of flatulence. Now why diabetic lycopodium? Because it has a ravenous hunger, excessive hunger, much like lycopodium, excessive appetite, canine hunger, much like lycopodium. So bloating like lycopodium, canine hunger like lycopodium. Again, why diabetic lycopodium? Because it has polyuria, profuse urination, polyuria especially at night. Polyuria especially at night. So frequent urination, polyuria like lycopodium. And along with the polyuria, you can sometimes get incontinence of urine, you can get burning in the urine as well. So if you make a urinary triad here, you can get some burning in the urine, you can get incontinence in the urine as well. The urine they are unable to control, but they have to get up frequently at night for urination like lycopodium. Why diabetic lycopodium? Again, there is complete impotency. Complete impotency. The sexual power is, the sexual ability is diminished. In case of lycopodium, old persons with strong desire but imperfect erections. So desire is good, but the erections are unfortunately lacking. So in case of uranium as well, there is complete impotency. There can be nocturnal emissions. So you can have nocturnal emissions as well in case of uranium nitricum. So night emissions. And you can have cold penis, cold organs. There is no erections at all. Penis is cold, penis is relaxed, that you can have with lycopodium and uranium nitricum as well. Fifth, you can have dropsy in lycopodium, you can have dropsy in uranium nitricum as well. And the three triad of uranium nitricum as a remedy, remember, you can have dropsy, you can have emaciation, so the patient has completely lost weight. So diabetic patients who have completely lost weight, kidney failure patients who have lost weight, and water retention, there is emaciation as well in case of uranium nitricum. and there can be ascites as well, so water retention in the abdomen. So general dropsy can be there can be water retention as well, and especially water retention in the abdomen, and the center of it is there is debility. Weakness is a constant factor. Remember, for Lycopodium there can be weakness in the evening, so evening aggravation of weakness, and even Boerhavia mentions for Lycopodium the debility is worse in the morning. So water retention in uranium nitricum, so dropsy is there, but especially if you do not get the general dropsy, if there is ascites, water collection in the abdomen, you can still think of uranium nitricum. There is emaciation as well, but at the heart of it there is always debility, and that's the sixth similarity with Lycopodium. There is a lot of weakness in uranium nitricum as well. So a lot of weakness in uranium nitricum as well. And many times one of the other associated factors, especially with the polyuria, remember you can have glycosuria as well, where sugar is emitted with the urine. Glycosuria, very persistent, very characteristic. Glycosuria, glucose with the urine, is very characteristic for uranium nitricum. And along with that, because of the diabetic Lycopodium, many times you can have a fishy smell with the urine as well. Greenish color can be there, but a fishy smell of the urine can be there in case of uranium nitricum as well. So bloating like Lycopodium, where there is more flatulence, lower abdomen. Ravenous hunger like Lycopodium. Canine hunger, in diabetic patients you can find canine hunger as well. Profuse urination at night like Lycopodium. Weakness like Lycopodium. Lycopodium's weakness can be either early morning or in 4 to 8 p.m. but uranium nitricum debility is throughout the day. Water retention, Lycopodium's water retention is mostly in the legs, upper part emaciated, lower part dropsical. So water retention of Lycopodium is mostly in the legs, but uranium nitricum water retention can be throughout, or more specifically concerned with ascites. So even Boerhavia mentions in introduction that his therapeutic keynote is emaciation, debility and tendency to ascites. So ascites, water retention in the abdomen, is one of its keynote of uranium nitricum, whereas in Lycopodium the dropsy is more in the legs, lower part dropsical. Sexual weakness is there in Lycopodium, there in uranium as well. Complete impotency, obviously nocturnal emissions, cold penis can be an associated factor as well. But if you consider the characteristics of uranium, these are the things, with glycosuria, which is very characteristic as well, with emaciation, which is also very characteristic as well. And on these combinations you can prescribe uranium nitricum. If you get the entire totality, go for 30C, go for 200C. Many times it's available in 6x and 3x tablet form as well, which is also equally useful. I've shared with you 10 remedies. Obviously it's a very long list. You can have many other remedies. I didn't mention eel serum, I didn't mention Stropenthus. I'll talk about that in the section with hypertension with albuminuria as well. So blood pressure can cause albuminuria. I'll talk about those two very important remedies which I skipped here. But I've given you 10 remedies which I use, which our family has used over the generations, which I use more often in today's 21st century, where the patient is reeling under the effects of hemodialysis. It's almost, you'll find, I've heard this so often, patients often die at the dialysis center because they cannot take that dialysis every week. The body is totally worn out, the body is totally fragile, the vitality cannot take it anymore. And these organopathics will come to your rescue, which has specific action on the kidneys to help reduce the frequency of hemodialysis and perhaps give them a smile back on their faces. Thank you very much.